These first concepts are actually not a specific page in your trail guide. This is kind of just sort of building blocks to where we're going. So the first thing I want you to start thinking about is the basics about muscles, is that, you know, we want to think about what angle the muscle is going, what direction the fibers are going, what the shape is, how it's crossing the joint. Because if we can picture that and then feel it in our hands, that helps us kind of do detective work to figure out what that muscle does. Because muscles are really pretty simple. All they do is shorten. And in that shortening, the only way they can get work done is by pulling. So muscles are never getting their work done by pushing, they're always pulling. So all they do is shorten, and whatever they're attached to, if that is allowed to move by that shortening, it will. So if we start with a very simple, just kind of one muscle over a simple joint, we could look at the biceps brachii right in the arm. And if we're looking at just one muscle crossing a hinge joint, if we attach over this joint that can only flex and extend, the muscle that's on the anterior side on the front, if it is attached somewhere here and somewhere here, and it shortens, the distance between here and here when it shortens, what's that going to do to this joint?
Decrease the angle.
Yeah, and excellent. And then what's that called? Flexion. Excellent. So it's like we're pulling on a rope here. Now, to extend here, the muscle on this side can't do that. It can't push that down. So we need a muscle that can now extend this. So where would we need to build that? Excellent. I see people pointing, right? So the opposite side, if we put a muscle here to here and it shortened, it could pull this direction, right? So we're just having these series of muscles on opposite sides of joints to pull to get the work done. Now, that's a very simplistic view, but accurate. But what adds to the complexity of it is that we have lots of different layers of muscles attaching in different angles at a complex joint, right? At a simple hinge joint, it's basically that simple. But at a complex joint, like a ball and socket, you can now picture these muscles crossing at all kind of different angles, and they work together. So we might have several, 2, 3, 4 muscles pulling or shortening in one direction, right? And then we have to do that in the opposite direction. The piece that makes it a little more complicated is that we are acting in a field of gravity. And the first example I gave you is actually a perfect example for this. And people complain about it all the time in their personal life. And a lot of people in this room probably have as well. So to use our biceps, we're usually in a position where we are activating that muscle. It's shortening, contracting our biceps, all good. But because in a field of gravity, we can just relax, we often don't have to engage our triceps to extend. So what ends up happening, so in gravity, this muscle can just relax. Now we can have a controlled, right, like partial contraction, partial relaxation, but that's kind of the thing that makes it a little bit more complicated. Questions so far?
Yeah. Because of gravity, we tend to not use certain muscles
as much. Exactly. And
muscles that we're overusing.
Exactly. So gravity is one great example. And so with this biceps triceps example, a lot of the reason I bring it up is a lot of people complain, right, that their tricep, they don't like, they call them wings or whatever. They don't like that they're softer, right, in this side. And it's because if you're just letting your arm go down, you're not really needing to engage your tricep, which is why there's all the different positions and machines in the gym, right, to do things like this. so that if I extend my arm in this position, now I have to use my triceps, right? So my triceps is doing this work, but it doesn't have to do this work, right? But the actual work is the shortening and the pulling. It's a basic concept, but the reason I introduced it at the beginning, and we'll kind of keep looking at it in different scenarios, is that we're going to learn over 100 muscles. And almost all of the muscles have multiple things that they can do. And most of the movements have multiple muscles doing it at the same time. And so it becomes a little bit complex, right? And so it's easier if you can picture where the muscle is, and then just picture like, okay, if this muscle shortens and it pulls, what's it going to do, right? Then trying to have to take every single muscle we memorize it just by pure memory. So that's why we kind of step back to that at first. The last piece that makes it a little more complicated is that the muscles also act together in a way that sometimes they're just stabilizing or preventing a movement. So let's take like the shoulder girdle, and we looked at the scapula a little bit. Sometimes we move the arm, but we don't move the scapula, right? And we keep that scapula just right down where it is. And other times we move it all together. So the difference there is whether other stabilizing muscles are preventing certain movements from happening. But the movement is always the same. Muscles can never get their work done by pushing. They can only get their work done by shortening and pulling. And why this matters as a massage therapist, to give you a sense of where we're going with this, is that we are helping people, whether they're just sore and tight, just general muscle tension relaxation, or whether they have specific injuries. And a lot of times, and pain, of course. And a lot of times this is exacerbated by various postures as well. So I'm going to give you a super classic scenario that you're going to see thousands of times with tons of your patients. I would say the vast majority of your patients will notice this kind of general tension and maybe even pain behind their shoulders. Maybe it goes up into their neck. And a massage therapist who doesn't know their kinesiology is a lot more likely to just focus their massage right where the client says it's tight or painful, right? But if you know your kinesiology, we're going to be studying the body in a way where you'll become this detective, and you'll understand that, okay, well, if these muscles that are doing the main action are overusing, right, and these other muscles are, stabilizing, and the person's in a certain posture, you develop a whole picture in your mind of exactly what to treat. And even in that case of the muscles, they're right in the middle of the shoulders. I always step away to a skeleton on this, and I'm not used to a little tiny camera. So let me just try to bring this over and just flesh this out example a little bit more. So this person is articulated pretty badly here, the way their shoulders are pulled in. But with this example here, if somebody just knows the person's tight and in pain right here, oh, thank you. The massage therapist who doesn't know the kines might just focus on the rhomboids and trapezius right here. But then what we'll notice is that very often the client will be like this, and it could be from phones and computers. But already, what do you know with your movements? What kind of movements are we being held in like this? What are my shoulders doing? Protraction, good. So scapula forward. What is this movement? This one is adduction. Yep, good. How about this? Yep, it's also flexing and it's also rotating, right? So you're all right. We got this medial rotation, we got protraction, we got flexion. And so these muscles here, right, they're all pulling from this direction. Go into that position yourself right now and feel how you're harder here now. Go ahead and go in a different position and feel. And now go like this. You feel how they're all tight, hard, sticking out, bumpy. So when you're like this a lot, these are the ones that are actually overworking. So this, you know, is kind of like actually the one that's being bullied, right? If this is being pulled forward all the time, we got a problem up here. This has developed a problem here too, but these are the ones that are actually underutilized right now. And we're going to treat them too, but we're going to treat them differently. And all those charts over there, the trigger points, you know, we'll study that after the basic muscles, but they're going to develop trigger points as well. And the other thing is you're also going to study where the muscle starts and where the muscle ends. And those can be very powerful areas when you're treating as well. So again, rather than like just right here, you're going to know the muscles that start here and end here, the muscles that start here and end here, the muscles that start here and end here. And so you're going to be treating this whole pattern instead of just right where the client says they're in pain. But keep thinking about it in terms of what the muscle actually does and those directions of the fibers, right? So that's kind of where we're going. Does that bring a question? Yeah.
When you're saying like a muscle starts here and ends here,
Yeah.
How do we know what is the starting point and what is the ending point? Or is that something that we just kind of assign? Or?
Yeah, excellent question. And so we're going to dive deep into the shoulder starting like next week. May I borrow this one? If you have a model that has red and blue, the red refers to origins, which is the start, and the blue refers to insertions, which is the end. The basic is that the origin is the side that's less movable or more stable, and the insertion is the side that's more mobile. And generally, almost without exception, the more stable side is going to be towards the core, right? Because it's just logical that our main center point is moving less than our limbs, right? So if we have a muscle that crosses, you know, from the center to a limb, the origin is going to be towards the center and the insertion is going to be towards the limb, right? Because this side is going to move more than this side. Now, does that bring up a question so far? Every muscle we study, and you can flip to any page in your trail guide, any muscle, and you'll see an origin and insertion listed. So the origin is the start point. The insertion is the end point. Origin is less mobile. Insertion is more mobile. Now that is true for the vast majority of muscles. And it is a useful way to look at them. But just so you know, some kinesiologists like to move away from that and just call them all attachments. There are certain muscles where there is movement in both sides, but we still say one is the origin, the other is insertion. Yeah. Like if you look at a muscle right here, and we could move our shoulder, or we could move our head and neck, right? But in most cases, one side is more stable, one side is more mobile. Yeah. Does that bring up follow-up questions or other questions? And that's just a starting point, right? We're going to go muscle by muscle, and sometimes it'll make more sense, and sometimes it'll be a little overwhelming how many muscles there are. This one is unstable.
Are we going to learn every single muscle?
That's also a great question. Are we going to learn every muscle? No. So we're gonna focus on over 100 muscles. We have 2 quarters to learn them. We're not going to learn them all this quarter. We focus on sort of the most important muscles to massage, all the major muscles. And where we don't get into all the details is, well, deep muscles we don't massage, like in the reproductive area. Tiny muscles in the hand, tiny muscles in the feet, tiny muscles in the face. Those are the ones that we don't worry about, but we do learn all the other major ones. Yeah, Hannah.
So something I thought of last night, we were talking about the draping.
Yep.
And the gluteal muscles, for example. When I've received a lot of massage in my life, and I've never had a massage therapist try to undrape my gluteal area. I mean, maybe just like a little side of it, but not the whole area. So I was thinking about that last night. I'm like, why do we need to do that? I don't know. Is that something that you do when you work?
So we never undrape both glutes at the same time, and we never undrape past the crack. So when I hear you say they just undrape a part of it, that sounds like when we undrape the glutes, that's what we're doing.
I'm talking about like a third over, and never more than that. Like, I've had a lot of massage. I've never had anybody try to go even halfway. I don't know.
So halfway is the crack, right? So
Okay, quarters away.
so here's the sacrum, and I'm not very good at drawing, but let's say that's a butt cheek, and let's say that's a hamstring. First of all, Anna's talking about a conversation that the therapist had yesterday. So a little bit of background is we were just talking about when we start to do Swedish massage, we start with the back and shoulders. And if we undrape parts, we always get permission. And there's always some areas you always get permission for. And you might drape, might massage through the drapes, or you might massage undraped. And people ask, do people take off their underwear? And so we started to have a conversation about that. And, you can always leave your underwear on. Some clients do, some clients don't. But if they give permission for a gluteal massage, and if they take their underwear off, and this comes later, we're not doing any of this at the beginning. It's one of the last areas we learn how to undrape. But when we undrape it, we would keep them fully modestly. We'll do a very modest leg drape, and then just undrape like a side of it. So they're fully tucked here and fully tucked here. And this is all completely covered with drape. Does that answer your question?
Yeah.
That's from down here. And then from up there, it's just opposite. Sorry, Anna, let me show the other way and then ask you again. And if we were undraping the back, this would all stay draped. And we at most would come on an angle like that. So never crossing the middle.
See, that's more than I've ever had too.
But it sounds like they're doing their job.
Yeah, it's always been really like, it's been like just like a little side or something. So I thought, yeah, I've never had somebody like really go all the way over. They've always done mine over.
That might be their comfort level too.
Yeah, so I mean, I feel like it's jumping ahead a little, right? Because I mean, we're not showing a draping demonstration, and so it's a little hard to fully explain or fully show you without a human, and you have no draping experience yet, right? And so we're going to teach you step by step with the back and very modest. But I think the most important thing to keep in mind is that whatever we do will be the most conservative, modest possible, and that it's always client comfort, right? So I explained this yesterday, that I've worked at some places where like everybody leaves their underwear on. I've worked at other places where almost nobody does. I've worked at places where most people want a gluteal massage. I've worked at other places where most people don't. And then I've worked at places where it's in between, right? So everybody has their different comfort level, whether that's an area they want massage directly on the skin, through drapes, or not at all. But we will be the kind of massage therapists that are just always super clear. We get written and verbal informed consent, and we always respect the client's boundaries. And by the time you get to this draping, you'll have draping experience and know how to drape and undrape the leg in the most modest way, which is all the way around the leg, which is not how massage therapists used to do it. So you might have had a less conservative drape, and then just a very little undraping on the glute, if you know, that's what you and the client want.
Are you saying like, why would you massage the glute?
Oh, no. I think we should.
We have the most conservative draping. We have a reputation out in the field that, you know, our folks know how to do all those things safely. So you're not going to be doing things less safely than you've had out in the field. Yeah, I mean, I think I hear some anxiety behind what you're saying, some concern.
Oh, no, it was just kind of I was just thinking about it last night, and I'm like, yeah, I've never had anybody really undrape me there, or even asked to, actually, very much. It's just kind of just, or they've asked, but when they have asked, even, it's just been like this kind of a side.
This is just a side.
Yeah.
This is just a side.
So it was just from our casual conversation yesterday to underwear or not underwear. Okay.
Yeah. And that those kind of questions and concerns do come up for some students when we start, you know, we start to talk about the fact that after the next module, which is all clothes on, after that module, we do start the skin to skin massage. We start very cautiously with the back. And I will tell you that the other massage schools do not start with the feet and then a fully clothed routine, right? They just jump right into it. So we do everything baby steps, right? So we're going to start with an area that most people are most comfortable with. And then by the time, you know, one area at a time. And by the time you do this, which will be last, you'll have skills and including your draping and your communication skills. Yeah, but we keep it very safe for the client. Yeah. Yep. And the students, you guys are clients when you're students. So it's your comfort level too, right? So just always keep that in mind when we have a demonstration. If there's something that, you know, you need to work with a certain classmate to feel safe, or there's a certain technique you need modified because you're not comfortable with that area or whatever, you know, you are like a client in that sense when we're in lab. Back to kinesiology. All right, so some of this, you know, is just different diagrams to explain what I already talked about. This is from a textbook that is by the same people as your trail guide, but it's a trail guide to movement. And we have copies on the shelf if you want to explore any of these. But, you know, we're starting with a simple example here. And they're using the muscle that's here on the left. This muscle is actually the one deep to biceps, biceps brachii. This one deep to it is called Brachialis, and you may recognize in that word, like, anyone remember the name for the arm region? Brachial, yeah. So you might hear in those two muscles names, it sounds a lot like brachial, right? Because they're in that area. Now, in this picture, like I said, it's the deeper muscle called brachialis. We often think about biceps brachii because it's the one that you see on top, right? And so it's the one people notice. It actually also can supinate. So it's actually doing two jobs and it's a little more complicated. But the deep one only shortens and flexes. So it just flexes the humerus here. That's just a preview. I don't expect you to know those muscles yet. Just showing kind of how those forces work. And so when the muscle contracts, you know, this part that's kind of in a terracotta or pinkish color, those are the actual muscle fibers that can do the contraction. So that's the part that actually shortens. And then there's a tendon that's directly attached to those fibers. And that's where it is attached to the bone. And so here is kind of a classic example down here at the bottom of how this muscle you know, these fibers kind of go into a tendon and it attaches right there. So the muscle pulls on the tendon, which pulls the bone, and it's because of the joint that allows that movement. In real muscles, the tendons actually have a lot of different shapes. And when you're looking at the pictures in Trail Guide, you know, you're just looking at this terracotta or pinkish is the fiber, and then this kind of grayish, whitish is the tendon. And so some of them are like the classic, like if you feel at your lower arm, there's these long, skinny tendons, and they're like about this long, and then these shorter muscle bellies. So if you feel up your arm and you kind of flex and extend your wrist, and you can feel all these kind of like ropey, slippery, skinny, those are tendons. And then if you keep feeling, when you're about 2/3 of the way up, you can feel how they now start to feel kind of flatter and ropier and bumpier. That's the muscle belly. And so as massage therapists, it's this part, right, that we can really release, and not so much the tendon, right, that it's pulling on. And this is kind of that classic muscle belly goes into long, skinny tendon. But there's a lot of muscles where that muscle belly attaches to shorter tendons directly into bone. And this might sound like a lot at the beginning, but next week we're going to look at more muscles in detail in the shoulder. And I just don't want you to picture that all muscles have this long, skinny tendon. Yes.
So, the thing with like carpal tunnel
Uh-huh.
issues,
Yeah.
What is the actual issue that's going on in there?
Yeah, so they can be caused by different reasons, but basically you have like carpal tunnel, you actually have like a little tunnel in there right here. And so there's only so much space for the structures to fit through, and it's tendons and nerves and arteries. And so for various reasons, they can get trapped in that tunnel. It could be inflammation, overuse syndrome, various things making not enough space in that tunnel. So a good example of inflammation is like people can get carpal tunnel syndrome during pregnancy, just if they have inflammation in there, compared to like an overuse carpal tunnel. Yeah. But as massage therapists, you know, we can work with if there's like a fascial restriction there, and we can also work with if there's trigger points and tightness with the muscles that are pulling onto those tendons. Yeah. Yep. Taylor.
So we pretty much never work directly on a tendon. We're always working on a muscle.
Yeah, that's a great question.
That's what I got out of what you said too.
That is basically true. There can be connective tissue and muscles kind of bound up with a tendon. And so we'll learn a few techniques where we'll kind of like move the tendon. There's a very simple technique where it's called Golgi tendon organ release, where you take the tendon and you put either like a C shape to it or an S shape to it. And by holding it steady, it resets the proprioceptors of the muscles attached to it. So that would be a time where we're actually touching the tendon, but we're not like doing a normal massage technique to it. Yeah. Yeah, they don't really respond or release in the same way, but we can release like fascial adhesions to it. And you guys are awesome with your questions. You know, you get very advanced and jump ahead. But of course, some of these techniques and issues are kind of advanced, and we will most definitely come back to them second quarter when we're ready for treatment massage. And we'll learn all the awesome techniques that you can do for treatment. I think it's a good time for a lunch break. And then when we come back, we'll look at the